Aggressive tumor cells are defined by the rapid, unchecked division. To sustain this continuous multiplication, they require a massive and constant supply of structural resources to build new genetic material. One of those crucial resources is uracil. Uracil is a naturally occurring nucleobase that forms the foundational architecture of RNA, making it strictly required for cells to transmit genetic information and replicate. Looking at this side-by-side molecular schematic, we can observe normal uracil on the left and 5-fluorouracil on the right. 5-fluorouracil, or 5-FU, is a synthesized chemotherapy medication. As the diagram highlights, its physical structure is nearly identical to native uracil, with the sole exception of a single strategically placed fluorine atom. This exact structural similarity makes 5-FU an antimetabolite. An antimetabolite is a chemical that closely resembles an essential cellular substance, allowing it to enter biological processes undetected and sabotage them from the inside. The structure itself is an intentional disguise. The lethal efficacy of this drug relies entirely on molecular deception. By sneaking a sabotaged building block into the cell's foundation, the treatment turns the tumor's massive resource demands against it. To understand how the sabotage executes, we must look at the S phase of the cell cycle. The S phase, or synthesis phase, is the specific window in the cellular division process where a cell actively duplicates its DNA. During this synthesis window, the cell operates under severe time constraints and urgently requires a massive influx of a specific nucleotide called thymidine. Thymidine is a unique building block strictly required to construct new, stable DNA strands. In this abstract representation, we see thymidylate synthase, or TS. TS is the specialized manufacturing enzyme responsible for chemically converting uracil-based precursors into that essential thymidine. Without the TS enzyme functioning, thymidine production stops. 5-FU acts as a pyrimidine antagonist. A pyrimidine antagonist is a drug that specifically competes with natural biological molecules to bind with and neutralize their targeted enzymes. Because of its disguise, 5-FU beats normal uracil to the TS enzyme, blocking the receptor pocket completely. By targeting the distinct temporal window of the S phase and neutralizing a single specific enzyme, 5-FU forces the most aggressive, fast-growing tumors to effectively poison their own supply lines. The moment 5-FU successfully inhibits the TS enzyme, the cellular manufacturing process experiences an immediate, hard operational halt. Because the conversion mechanism is jammed by the decoy molecule, the downstream biochemical deficit is absolute. The cell produces zero new thymidine. Deprived of thymidine, the cell cannot complete its DNA replication. The structural integrity of the newly forming DNA and RNA permanently fractures, leaving the cell with incomplete, corrupted genetic code. As seen here, this specific mechanism of cellular destruction is known as thyminless death. Thyminless death is a biological state where a cell initiates rapid self-destruction precisely because it lacks the necessary nucleotides to maintain its genome. This chemotherapy regimen achieves target destruction through weaponized resource starvation rather than a direct toxic burn. However, there is a critical biochemical limitation. On its own, the initial bond between the 5-FU molecule and the TS enzyme is weak and prone to detaching. This instability often allows the cell to clear the decoy and resume DNA synthesis, which is why 5-FU is rarely administered as a standalone therapy for internal oncology. To solve this, oncologists introduce a synergistic agent, leucovorin. Leucovorin is a synthetic derivative of folic acid utilized in medicine to modify and enhance the biochemical action of targeted drugs. Leucovorin physically binds to both the 5-FU and the TS enzyme, creating an inescapable ternary complex. A ternary complex is a stable chemical structure formed by the tightly bound union of three distinct molecules. This locked state stabilizes the bond, extending the duration of enzyme inhibition and increasing the overall lethality of the chemotherapy regimen. This exact molecular lock is the functional engine behind widespread clinical treatments like FOLFOX. FOLFOX is a combination chemotherapy protocol that utilizes 5-FU and leucovorin as its core components. True chemotherapeutic success often relies on exploiting secondary biochemical systems to forcefully optimize a primary drug's binding affinity. Transitioning from the subcellular enzyme level to the macroscopic, whole-body perspective reveals the clinical reality of administering 5-FU intravenously. This anatomical model highlights the primary internal malignancies targeted by systemic 5-FU. It serves as the backbone of treatment for colorectal cancer, while also effectively targeting breast, stomach, pancreatic, and head and neck cancers. Yet the drug possesses a severe physiological flaw. It cannot distinguish between a malignant tumor cell and a healthy human cell. Its only trigger is rapid cellular division. This indiscriminate mechanism leads directly to mucositis. Mucositis is the painful inflammation and ulceration of the mucous membranes. Because the healthy cells lining the mouth and digestive tract naturally have an incredibly fast turnover rate, 5-FU mistakenly targets them for thyminless death, causing severe sores. The same biological vulnerability? Myelosuppression is a condition where bone marrow activity decreases, leading to a dangerous drop in white blood cells. The bone marrow rapidly divides to generate immune cells. 5-FU halts this production, drastically increasing infection risk. Patients also frequently experience hand-foot syndrome as a systemic consequence. Hand-foot syndrome is a localized dermatological toxicity, causing severe redness, swelling, and pain specifically on the palms and soles. A patient's systemic side effect profile serves as a direct, predictable map of the body's highest natural cellular turnover rates. To bypass whole-body toxicity for certain superficial conditions, 5-FU can be deployed through an alternative delivery route, topical application, via heavily concentrated creams or ointments. This epidermal cross-section shows indications for topical use, which are strictly isolated to the upper layers of the skin. It is prescribed for actinic keratosis, a rough, scaly patch of precancerous skin damage caused by UV exposure, and superficial basal cell carcinoma, a slow-growing form of early-stage skin cancer. At the specific site of application, the localized side effects are fierce, resulting in severe redness, intense scaling, and deep crusting of the skin tissue. Clinicians interpret these aggressive topical reactions as evidence that the anti-metabolite is successfully infiltrating and destroying the targeted fast-dividing damaged cells. Altering the administration route physically restricts the molecular collateral damage. By applying the decoy molecule directly to the lesion, oncologists safely concentrate thyminless death only where it is required. Patient safety relies on one final critical variable: the body's native ability to metabolize and clear the highly toxic 5-FU molecules out of the bloodstream once their job is done. Looking at this metabolic pathway, we see the specific gatekeeper enzyme responsible for this breakdown, dihydropyrimidine dehydrogenase, or DPD. DPD is the primary metabolic enzyme responsible for dismantling pyrimidines, including the synthetic 5-FU, allowing them to be safely excreted. However, a severe genetic anomaly exists. A small percentage of the population possesses a DPD deficiency, producing little to none of this clearance enzyme. This triggers a lethal cascade effect. Without DPD, the body entirely loses the capacity to break down circulating 5-FU. The clinical consequence of this buildup is absolute. A standard therapeutic dose of 5-FU rapidly accumulates into life-threatening systemic toxicity. Because of this specific metabolic bottleneck, strict genetic testing or screening for DPD deficiency is now a mandatory prerequisite before any medical team initiates a systemic 5-FU protocol. Even a perfectly calibrated biochemical intervention becomes a fatal poison if the patient's underlying genetic hardware lacks the code to process it. At its core, 5-fluorouracil relies on simple pyrimidine antagonism to halt thymidine production and force rapid, thyminless cell death. Administering it successfully requires a highly delicate clinical balancing act, maximizing the drug's destructive efficacy via leucovorin synergy, while diligently mitigating fatal metabolic risks through strict DPD screening. Mastering the application of 5-FU demonstrates exactly how modern oncology relies on precise molecular manipulation and deep genomic awareness to turn a simple cellular decoy into a life-saving therapy.